Well, hello, everyone, and welcome to this discussion about biosecurity education for youth. If you're attending this webinar, you probably already have a deep interest in educating our next generation of livestock producers about how to keep their animals healthy. And thank you for the work you've done so far and the work you're going to do. Well, let's introduce our speakers. Dr. Julie Smith is a veterinarian and the Healthy Farms, Healthy Agriculture Project Director and Research Associate Professor in Animal and Veterinary Sciences from the University of Vermont. Pam Watson is a Washington State University Extension 4-H Youth Development Specialist and Assistant Professor. She's an apprentice national poultry judge and longtime poultry breeder and enthusiast. And I'm Susan Kerr, a veterinarian and retired Washington State University Livestock and Dairy Extension Specialist. Well, raise your hand if you've had dreams in which you're wearing a face mask. It's been nearly a year since the COVID pandemic has started affecting our daily lives. And Julie and I were recently discussing how COVID has made this a teachable moment for biosecurity because so many good disease prevention practices have become second nature for people of all ages. Julie, hello. And what do you think some of these practices are?
Hi, everyone. Good to be here with you. Susan, I'm not one who's been dreaming about wearing face masks, but for sure, face masks is one of these practices that I hope folks have taken on, that maybe we're getting used to, maybe a little too used to, but it's really important, right, for a biosecurity practice for preventing the spread of COVID-19, because we know that the virus is spread through droplets and aerosols. So by wearing a face covering, we can certainly prevent disseminating virus spread if we cough or sneeze, and it has some reduction in inhaling the virus. Face masks are also a great example of what we know of as PPE. So people are becoming more familiar with this acronym, which stands for Personal Protective Equipment. So PPE, we're talking about face masks, disposable gloves, disinfectable footwear, designated clothing such as coveralls. So you see how this transitions from just COVID to things that we can do in the barn for biosecurity. And PPE worn correctly helps protect us from getting sick, and it helps keep us from spreading disease agents from one place to another, particularly if we remember to take off our PPE once it's been contaminated.
That's right, Julie. We have to wear the masks properly over both our mouth and our noses to be effective. What other actions have you seen people taking to reduce the risk of COVID?
Well, another really important practice is washing our hands. And people have been talking about washing our hands for years, how important it is to keep us from getting sick, keep us from getting zoonotic diseases, keep us from getting foodborne illness. People, especially children, I think are washing their hands more often. And there has been more information about how to wash our hands properly. Most of us take it for granted that we know how to wash our hands. But if you've ever watched one of those WHO videos about how to properly do it, they're serious. It's serious business washing your hands. So if you do that right, you're going to reduce a whole lot of disease, influenza, other zoonotic diseases, foodborne illnesses, and so on. So hopefully we're seeing benefits of that, and hopefully we'll keep going with this practice and people will be healthier all around.
Is there anything else we've been doing right from a disease control standpoint?
Well, sure. Another one of the big points for COVID protection is social distancing. So we can see how these birds are being socially distant and how we in the grocery store are staying 2 carts or a cow length apart. So we're doing this to make sure that we're further away from the germs that someone might be exhaling or coughing or sneezing. And having that good fresh air is always good for biosecurity. And we've been talking about this in livestock and poultry for a long time when we talk about stocking density. So how many animals do we have in a certain space? How do we, another piece that we talk about, it's kind of serious social distancing, right? If we're asked to quarantine, so if we've been exposed to someone who tested positive for COVID, we go into quarantine. The person who tested positive is isolated. So in both cases, you're really isolating yourself. And we do that with livestock and poultry too, right? So if we go to a fair or a show and we're bringing our animals back to the home farm, we want to isolate them for a period of time. If we purchase new animals, we want to isolate them for a period of time, make sure we have a chance to make sure they didn't pick something up, maybe do some testing. So social distancing, quarantining, these are also practices that we've gotten used to that are important for human and animal biosecurity.
This our next slide shows the results of a survey of livestock and poultry owners. It was done in 2012, and it shows that we really could be doing a better job with quarantining. About half of the owners who responded to the survey do not quarantine new or returning animals ever, and it shows the reasons that they say that they don't, such as not having enough room or enough time or enough labor, or they trust the source of the new animals. And obviously, we could be doing a better job of reducing disease risk by quarantining new or returning animals routinely. What else do you think we could be doing better, Julie?
Well, I think a big one, and we're showing it on this slide, is the whole area of cleaning and disinfecting. So, a lot of people have spent time talking about boot washes or boot disinfectant stations. Well, you've got to be a little careful about it because some things are really hard to clean. And I find that boots are one of those really hard things to clean well. And it's the cleaning that is most important if you're going to prevent the spread of disease-causing agents from one place to another. The disinfectant is just like the cream on top, right? That's just going to take care of specific organisms, but we're doing most of the job with that cleaning. Soap and water, that's most of the job, but it takes time, right? So it takes time. You've got to have the right equipment, the right tools, and sometimes it might be more efficient and more effective to have boots and maybe coveralls or other equipment that's reserved for use in a particular area so that you don't have to worry about cleaning and disinfecting what you're wearing everywhere, but you have a special pair of boots you can change into before going into a more high risk area of the farm.
Do you think we can apply lessons we've learned from the pandemic to our farm biosecurity practices? And do you think people will actually make these changes into habits?
Well, I think some of the changes will become habits, but as much as people are creatures of habit, we're also prone to take shortcuts. Hopefully, our recent experience with COVID-19 will help us recognize that we have to be vigilant and we have to be dedicated to complying with the practices every time, right? That's the routine part of it, getting it down to being a habit so that we can protect ourselves. Same thing when it comes to biosecurity for livestock and poultry. We have to do it every time. Even if we don't know about a big disease threat, there's lots of diseases that can go around, and we never really know when something big is going to come until we've got it. So the way to keep it out of our farms is to practice biosecurity. We have to understand what the important transmission risks are. How do we manage those risks? We've got to get the education across and start building good habits when people are young. So everything that you're doing with your youth programs is really, really important to get those habits built early. And we have some resources that Joanna showed earlier. We've got the online interactive learning modules, and 2 of those modules focus on this specifically, on identifying risks and then figuring out what strategies are most important to help reduce those risks. So those are learning modules 3 and 4 if you're interested. So Susan, we've been talking a lot about COVID and what lessons we can learn from that for biosecurity. And, um, COVID itself is believed to have started in animals, but we saw once it got into humans just how fast it could spread, and it went around the world. Are there livestock and poultry diseases like that we should be concerned about?
Well, livestock producers and all of us interested in animal health, we're always concerned about foot and mouth disease, of course, but there's several other diseases of concern that are currently active around the globe, and some are even here in the US.
Are these specific to a certain species, or what kind of species do these affect?
Well, as the list we're showing here, that list shows that there's unfortunately a little something for everyone. This is a list for the World Animal Health Information Database from the World Organization for Animal Health, excuse me. It's a list of the highly contagious and fast moving diseases that are monitored by the OIE. And these are for the week of January 28th. The new list goes out every Friday. And this list shows that African horse sickness has been present and active in Malaysia and Thailand for a while now. And highly pathogenic and low pathogenic avian influenza are widespread throughout Europe and Asia. And wild waterfowl can easily spread this disease to domestic poultry, so we're concerned about that. Vesicular stomatitis is a vesicular disease that had a busy year in the US last year, mostly affecting horses and some cattle. And we can't forget rabbit hemorrhagic fever, which was formerly a foreign animal disease in the US, but now it's considered regionally endemic. We had it here in Washington, and it's in the Southwest and other Western states as well. We finally seem to have virulent Newcastle disease stamped out in the US, at least for now. And our this next slide shows that African swine fever, it's active in Europe and Asia for most of last year, and it's estimated it's killed 25% of the world's pigs. It's just a massive, massive concern. And it's a disease of concern because the virus is hardy. Can be spread through many different ways, and the little timetable there shows how long it can last in different environments and in different substrates and so on. And it's just a real problem that we don't want to get in our country at all.
So that list that you showed from the OIE and even the poll, there's a lot of diseases and the list seems a bit overwhelming. Can we break it down into bite-sized pieces? And how about starting with HPAI, highly pathogenic avian influenza, because this is something that we regularly see circulating around the globe, and we've had outbreaks of this in the United States. Susan, how does HPAI affect the typical 4-H or FFA member? What should they be concerned about, and what should they be doing?
I'm going to punt your question to Pam Watson because she's beak deep in the poultry world as a longtime breeder. And she's an apprentice national judge, and she's also a 4-H youth development specialist in Southwest Washington State. Pam, hello. And how have you been educating youth about high path avian influenza?
Well, like many of you, I see kids through many different events. And we saw in the chat, some of you are superintendents or judges or work with extension. And whether you teach or judge, some of the things I do are ask questions to check for understanding. Remember, we're working with kids, so it has to be relevant. Like asking, how does this relate to your flock? And you really need to ask those kinds of questions before you ask bigger questions like, how might this affect the poultry industry? So remember to bring things down to the level of the youth.
Okay, thanks. Have you seen youth doing anything differently because of HPAI, whether it's doing something new or not doing something they used to do?
Well, first I want to start with something that I've seen in the last 8 to 10 years that I'd like to not see. And that's youth kissing their animals, specifically poultry, because they're small and and look readily cuddleable. So we'd like to not see that. However, there are things that I think kids are doing differently. They're thinking more about changing their clothes when they get home, or they're planning ahead so that when they get home, they can also change their footwear. They're thinking a lot more about people handling their animals at shows and especially fairs of the public. And they're still letting them do this because that's something that we do in 4-H, but they are being a lot better about asking people to wash or sanitize their hands after they touch the animals and before they eat. I've also heard kids talking more about quarantining animals when they get home, and some heavy debate on what is an appropriate quarantine time. Some things that they're not doing anymore is wearing the same shoes at home or their as they do at shows or club meetings. And then we used to see kids running around with their birds in their arms all the time, sharing birds with their friends, passing them around. Now it tends to be more mom or dad, can you hold my bird? Not sharing them around with friends as much. So I really do like to see that with the kids.
Well, that sounds like some good progress. What other biosecurity related issues have you seen as a judge?
My favorite one as a judge is dirty birds. You know, the birds come to a show, they're there to be showcased, and they're dirty. And I'll move on to open bottom cages. You know, these are ways that we transport things from home that we really shouldn't be sharing around, especially the showroom floor. Whether it's dirty boots, open bottom cages, or dirty birds, these, you know, we kind of can leave a trail as we go through the showroom, or we find our cages, or we go to maybe our vet check-in. So those are some issues. The other thing that I see and sometimes feel as a judge are birds with parasites. And that's anywhere from lice that we can see with our naked eye, or as a judge I might feel, to scaly leg mites.
Are we getting any better at biosecurity at shows?
Well, the short answer is yes. And I think we're living the life lesson with COVID-19. So we're learning some things as we go. I think it's really important to demonstrate or do what we talk about, whether we are 4-H leaders at a 4-H meeting, or we are 4-H leaders as individuals exhibiting at an open show. We need to talk the talk and then walk the walk, and make sure we're doing that for our youth. You know, there's cell phones around, and we want to be portraying ourselves and what we're doing with our animals in the best way possible. I do really appreciate that we're getting the word out in several different ways and different formats, especially using photos and graphics.
Okay, do you think that there's anything else we can do to promote better biosecurity at shows?
Right. Well, I think 4-H can continue what they've been doing for almost 120 years now. You know, share with the kids, whether it's 4-H or FFA kids, share about biosecurity, teach some different things. Clearly, they're sharing with their peers. We see that at shows all the time. They're going to share with parents and other adults, whether that is other adults in their club or the public. Make it fun. We know kids are if they have fun, one, they're going to stick around, and two, they're more likely to learn. Use pictures and graphics to illustrate. And I'm thinking more of those young youth who aren't readers yet in our Clover Bud age group. So probably kindergarten through 2nd or 3rd grade, depending on your state. And how popular of a project poultry is for our Clover Bud age group. And keeping that in mind, but for everyone, keep it simple.
Something I like to emphasize when I talk about foreign animal diseases and biosecurity is that if one of these nasty bugs enters the US, it's going to hit somebody's farm first. And we need that person to be knowledgeable and responsible. And the knowledgeable part comes with knowing the signs of the diseases of concern and knowledge about what to do if they see them. And they need to be responsible and that they'll take the appropriate action promptly. And that means if they have a big increase in sick animals or dead animals or signs of disease that they've not seen before and don't understand, they need to contact their veterinarian right away. With diseases like foot and mouth or African swine fever or avian influenza, we've got to get those outbreaks contained quickly so there's as little impact on economics of both farms and communities, and as few animals need to be depopulated for control as possible. Pam, how do you think we can get this message across to youth and adults you work with? It like if they see something, say something.
I say again, keep it simple. Be like Pete. Make it memorable. Catch their attention with a photograph, a graphic, or a meme.
This would be a good place to incorporate some of the character counts curriculum lessons.
Since citizenship is one of our 4-H national mission mandates, I already incorporate citizenship and responsibility into my poultry basics discussions by talking about bird numbers allowed in your area, males in the neighborhood, and waste management. We talk about the impact and thinking ahead for these things before you get birds, preferably.
Pam, you've discussed the need for youth to be a wise consumer of education with youth, haven't you? In other words, you teach them to consider the source of the information they're receiving?
Yes, I really listen to how the kids are asking and talking about things. And if presented with false information by a 4-H member, I first try to ask where they got the information and why they believe that to be true. In Poultry Basics, we talk about being buyer aware, having the buyer beware, and taking information with a grain of salt and why we have to be careful. At the end of the presentation, we always try to have an updated resource list with solid information and make sure that those lists stay current.
Yeah, people need to be aware of the diseases that are active in their area, but they need to get facts. Here in Washington, we have a listserv for people interested in news alerts. It's sent out by the Department of Agriculture, and people can subscribe to that so they can get facts about a situation quickly and accurately. And there's the National Equine Disease Communication Center, where anyone can sign up and be notified about diseases and disease outbreaks in the country. And these are reported only to the level of a county basis. It's really helpful to have those trustworthy sources of information when there's so many sketchy and inaccurate sources available through social media.
Yeah, especially during this time with COVID, just keep talking to your 4-H families and youth. Keep them in the loop as to new resources, updated resources, especially as we're coming into the spring migration for avian influenza. And remember to ask them questions for understanding and make it relevant to the kids.
Thanks, Pam. Everything you've shared is very helpful. Thanks so much. I want to turn something Susan asked you back to her. Susan, what did you mean by if you see something, say something?
Well, I was trying to emphasize the need for early detection of disease outbreaks, and it's going to hit somewhere first. Sometimes we'll find that disease through routine surveillance activities, such as swabbing birds for avian influenza at livestock markets or live bird markets. Sometimes it could be noticed during just daily chores, routine activities. Livestock owners are the eyes and ears for the entire animal industry and will probably be the first one to notice a problem. And youth are producers too, so their project animal could be the first one to be affected by one of these highly contagious and quick moving diseases we're concerned about. And actually, the first rabbit hemorrhagic disease case in Washington affected a 4-H buck, and the youth owner knew to contact her veterinarian for help. And because of that, we were able to get that disease diagnosed quickly and get the word out to people that this disease was active in the area and people could take appropriate precautions. If we detect things early and we can apply the control measures quickly, whether that's going to mean a quarantine or vaccination or depopulation or whatever. And if we control a disease early, we reduce its economic and animal welfare impacts. The economic impacts of some of these diseases are in the millions, if not billions of dollars. And some of these would have significant ripple effects in our rural communities as well.
You know, these things that we've talked about with livestock and agricultural animals apply equally well for our small animals, right, Susan?
Large, small, people, animals, we all can get sick.
And the case with rabbit hemorrhagic disease, I think, is a really good illustration of something that turned up that's really highly contagious among wild and domestic rabbits. So having alert and knowledgeable owners is so important, and the youth and the folks that you work with who own animals really are the first line of defense to look out for things that look different, unusual, sick animals, signs of illness that need to be reported. So we really appreciate what you're doing to help youth understand what they can do to help protect their animals from getting sick, and then be vigilant and identify things when their animals are sick.
That's right. We need them to know what they're looking for and then know what to do. And we really need whoever owns animals to come forth when they see something that concerns them, and not the routine diseases, not lice or not bumblefoot or whatever that's routine, but these things that are perplexing or new or are affecting a lot of animals. They need to get on the phone and get some help. So if it's something new and something serious, we can get that contained and identified and minimize the impact. And I hope we can get youth to embrace biosecurity best practices. Public health professionals are predicting that the majority of new diseases in the future will probably emerge as a result of contact between humans and animals. And we have seen that climate change is responsible for parasites and insect vectors expanding their ranges, so diseases are appearing in areas where they've never been seen before. We never know where or when the next dangerous contagious organism will emerge first, but if we've turned our biosecurity actions into habits on our farms, we can hopefully escape that threat and keep boring farms, because boring farms are healthy farms. No emergencies, no outbreaks, just nice, healthy, boring animals.
Sir, can rabbit disease spread to dogs if they kill a rabbit?
That rabbit disease that I mentioned, the rabbit hemorrhagic fever, is species, well, kind of species specific. There's lots of genus and species of rabbits. It's only a rabbit disease. Unfortunately, dogs could spread it to rabbits just by moving around. They can get the virus on their feet or their fur and transfer the virus to new areas. But if you're talking about rabbits in general, yes, rabbits unfortunately can spread diseases to dogs. There's toxoplasmosis, and tularemia is a big one, and trichinosis as well. So dogs could get those if they kill and eat a rabbit, and tapeworms. Tapeworms as well.
Could wild rabbits spread disease to chickens?
People worry a lot about coccidia between rabbits and poultry. Poultry aficionado Pam Watson, what's your answer to that one?
So most of the time, chickens and rabbits don't share diseases back and forth. However, other poultry can share diseases back and forth. So we do talk about separating out like waterfowl from chickens or turkeys from chickens. However, that does not mean that you should house your chickens and your rabbits together, especially in letting them be in the same coop area together. Rabbits are not meant to be wandering through chicken or waterfowl excrement, and it does nothing for their pelt or their health.
Yeah, and wild rabbits, spreading diseases to chickens, they could physically move some things around on their feet, coli and salmonella, and those are the main ones I think about, but there's not a lot of disease overlap with wild rabbits.
Q&A, we have a dog that likes to eat bunny poop. Could that be a concern?
They get tapeworms by eating the actual carcass, not through the feces. They certainly could be getting E. coli and salmonella that way, and then of course you're going to not let that dog lick your face anymore, right, people?
Yes.
It's probably more an aesthetic issue than it is disease issue, but I can't say that it's a good practice to encourage or ignore because of the risk of some enteric bacterial diseases.
Or on the lips, which I see a lot. Another question, can rabbits spread diseases to other small animals?
I saw a concern raised in the chat about COVID-19, and even though we're most concerned about that going human to human, it has been transmitted to some animals in different situations. I see in my feed reports of zoo animals that have become infected with COVID-19. Mink farms have been particularly impacted by COVID-19. And there have been a few cases of companion animals that have been detected as having COVID-19. To my knowledge, and Susan might know more, but to my knowledge, it's not a high risk that people would then get COVID from the pet animal. But there have been a few cases where that's happened. And
I'm laughing at Nancy's challenges
I know.
typing over her cat. She has a cat that is very interested in laptops. Rabbits and hedgehogs, she says.
Oh.
Apparently rabbits can spread diseases to
okay.
hedgehogs and probably back and forth. And these are good questions that they're showing. We're concerned about wild rabbits spreading things to domestic rabbits and dogs and all these things. So that just tells us we really need to do a good job of keeping distance between wildlife and our domestic animals. There are things out there we know about and things we don't know about.
So we have another question for you
Whoops.
then. How do you recommend managing or monitoring wildlife? How do I determine to what extent this will be a concern or when to take action? Salmonella in songbird at feeders is one point they made, which is something that I think we can clear up pretty quickly by keeping the bird feeders clean, disinfecting them. But what about other wild animals?
Well, that's a time when it's important to get knowledgeable. Say you have small ruminants, sheep and goats, and you live in the Northeast. It's very important for you to keep white-tailed deer out of that environment because there's a serious parasite that it's not a big concern in white-tailed deer, but should it get into sheep or goats, it can paralyze them.
Or
and that's
llamas.
part of your, and llamas, right? Thank you. That's part of your obligation as an animal caretaker is to find out what is a risk in my area and what do I need to do. Around here we have migrating elk, and not that it's an issue here, but in parts of Montana, but parts of Montana have brucellosis in elk herds and buffalo herds. So measures have to be done to protect domestic cattle herds from interacting with those areas. Definitely, if you're a backyard or commercial poultry producer, you really should be thinking about wild migrating waterfowl, because lots of places, farms I see, small farms, it's very easy for migrating waterfowl to just plunk right down on that property and wander around amidst the pastured poultry. And that is just a high risk scenario. Really, if you're concerned about health, you need to find a way to protect your animals from those negative interactions.
Well, Susan, we have a question that takes it from the other side, the wild animal side. Can chickens spread diseases to ducks? I guess either domestic or wild ducks.
Well, I'm gonna let you know that poultry, chickens, and turkeys can interact and spread things like blackhead, whether they're domesticated or wild.
Ah,
And I'm not sure off the top of my head about ducks.
Of how do we get youth to be discerning consumers of information? You can type anything in Google, as you know, and you will get an answer. But sometimes the person answering has an agenda. They have something to sell you. They have some type of moral stance that they want to promote, and it might not be factual. We've got to do a good job of being discerning consumers of information. And there's something called, I'm going to put it in the chat box, the CRAP test. And it stands for current, oh dear, relevant, how accurate it is,
Yep.
the source, which is
Authoritative.
authority, and then the purpose of the information.
Yep.
You have to apply that to it. And generally the information from .edu and .org and .gov is more trustworthy than the .com sites. Not that there aren't very good .com sites, but sometimes they're too commercial to be totally trustworthy.
so there
Yeah,
was
correct.
a response in the Q&A from Karen, who said they don't have a local vet for livestock within an hour and a half of them. So they have to rely on other experienced owners, websites, group forums, and they feel like they're their best help because they don't have that vet nearby. I'm sure there's
Whatever state you're in, contact your state veterinarian and make that situation clear. That your state veterinarian's job then to complete this application for more veterinarians to come to your area. A big reason that there aren't more food animal veterinarians or farm animal veterinarians is because of the huge debt load that students have when they come out. And if you can get your area designated as an area of need or an underserved area, you can, veterinarians, graduates can apply to serve in that area. And by doing so, they can get significant offset of their loans. But it starts with your state veterinarian submitting an application to the USDA to be designated as one of these sites. Have many people, as you know, contact your state vet so they get sick of you and say, we need food animal veterinarians here. And the squeaky wheel gets the grease regarding these things.
And if you don't have a local veterinarian, hopefully the state veterinarian can be a resource for you. There's someone that I would encourage you to get to know. They're going to be very aware of the kind of global and state issues. Less so, they're not going to want to be involved with diagnosing specific issues, but they certainly can help with biosecurity education and even emergency planning for fairs and expos. So,
and if you have some relatively smaller animals, perhaps you could work something out with that veterinarian who's an hour and a half away. Take an animal there, a representative animal there, so you establish this veterinary client patient relationship, which is a legally recognized relationship. Then maybe for a year after that, you can communicate with the veterinarian over the phone, and that they can perhaps prescribe medication or communicate with you in that way through this legally viable relationship because they've examined a representative animal from your farm. Unfortunately, with the chat groups, people are often sharing what turns out to be illegal information. They'll tell you to use this medicine for that, or do this medicine this way. And because these are food animals, regardless of you ever plan to eat them or not, they are legally recognized as food animals. It's illegal for you to use a medication in any way other than what's stated on the label, unless a veterinarian, your veterinarian, has advised you how to give it and why to give it. And most importantly, how long to withhold meat and milk from human consumption.
very good. So Karen Patterson had suggested that they use their National Poultry Improvement Plan for some assistance. So there's another avenue that people can take too. We have a couple of other real quick questions. And I'll throw these questions out to our panelists, but also if you wanted to recommend right now, we're getting a lot of poultry and rabbit disease questions. If you have some good resources for right now that you can give these folks. But we have one person asking if migrating songbirds are a disease risk in poultry, and if rabbits get diseases while pregnant, can it spread to their offspring?
Is diatomaceous earth helpful for anything? Yes, it's helpful for the person that sells it, and that's it. Do not count on diatomaceous. If it were effective, we'd all be using it. We don't want to use chemicals and so on for and antibiotics and dewormers. So if it were helpful, we'd all be using it. All right, can chicken diseases spread to ducks? I would have to say some of them can. And what was the thing about
So migrating
birds?
birds, can they spread diseases to poultry?
It's really, avian influenza is carried by waterfowl and shorebirds, and it's not really a migrating songbird disease.
Well, there has been an issue for several years with salmonella in songbirds because they congregate around feeders.
Sure. And I think we can probably do a pretty good job of trying to keep those birds separate from our poultry and not have that overlap. The birds aren't necessarily creating that disease. Their environment is giving it to them, and our ineffectual sanitation of their feeders, and we can manage that through I think having two feeders. You have one that you're using and the other one you're having cleaned and disinfected and waiting to be used again. So you're always rotating them. So better thinking and management there.
And then a last one, can rabbits that are pregnant spread diseases to their offspring?
Nancy Basket. I'm calling on Nancy Basket. She's another 4-H extension specialist, and Pam handles the birds, and Nancy is our rabbit guru. And I'm waiting for her to say if that is the case. Not aware of anything. Okay. Unfortunately, probably the main thing is if the rabbit gets sick while pregnant, and significantly sick, the bunnies, the kits probably could die, be reabsorbed, be aborted, something along those lines.
So even though we don't expect leaders and instructors to be experts in disease, we hope that you will help work with youth to help them better understand biosecurity practices that can keep their animals healthy and keep themselves healthy.
Exactly.
And then refer the disease questions to other experts.
Right. We kind of dissuade 4-H leaders from doing any diagnosis or treatment recommendation. And you're absolutely right, is we need the training to be on the forefront and the disease prevention side.
Our project has provided some additional resources to help you with that. So if you haven't looked at the Healthy Farms, Healthy Agriculture learning modules, I encourage you to do that. And if you think they're of value to your youth, that you'll share them with your youth. And I'm personally happy to work with anyone who is using them with a group. If you have any questions or you run into challenges, I will let you know. Right now, the modules are undergoing some revision to help make them even better. So if you're identifying anything in the next month, we have the opportunity to get that addressed. So feel free to reach out if you're using them and you run into any kind of issue or have a question. It's great to have so many on. Thanks again. Be biosecure and be well.